Okay, this next section talks about the pituitary and pineal glands. Now if we look at this picture, this is a cross-section of the brain. So this would be the major part of the brain up here. We have the hypothalamus, which we'll learn all of the different brain parts a little bit later in the semester, but this hypothalamus plays a major role in the endocrine system. You can see it actually points into the pituitary gland. The pituitary gland is sometimes called the master endocrine gland because of all of the hormones that it produces and how it regulates or directs the activities of many of the other endocrine glands in the endocrine system. It's so important that we have this little crater right here, and that crater is known as the sella turcica of the sphenoid bone, and that kind of houses and protects the pituitary gland. So the role that the hypothalamus plays in the pituitary gland hormone secretion. First of all, if we look at the pituitary, you notice that there's this front lobe known as the anterior pituitary, and then there's this back lobe known as the posterior pituitary. And they're connected by this infundibulum. The hypothalamus produces the hormones that are released from the posterior pituitary. So the posterior pituitary doesn't actually make its own hormones. They're made up in the hypothalamus and just released from the posterior pituitary. Now, as far as the anterior pituitary goes, with the anterior pituitary, the hypothalamus regulates the release of the hormones from the anterior pituitary. So here they're actually made, but the hypothalamus kind of tells them when to release them. So like I said, we've got the anterior pituitary, and another name for that is the adenohypophysis. Then we have the posterior pituitary, and another name for that is the neurohypophysis. And they are connected by the infundibulum. So the infundibulum connects the anterior and posterior pituitaries. We're going to go through the 6 major hormones that are released by the anterior pituitary, starting with growth hormone. So what growth hormone does is it signals the liver to release insulin-like growth factor 1, IGF-1. And what IGF-1 does is it increases amino acid transport into the cells, so that increases protein production. It also has a hyperglycemic effect. It causes us to increase fat metabolism, which decreases carbohydrate metabolism. So if you're using fats for energy production instead of using carbohydrates, then those carbohydrates are kind of left behind in the bloodstream, thus causing this hyperglycemic effect. So too much glucose floating around in the blood. The growth hormone also causes a decrease in adipose tissue. Another word for growth hormone is somatotropin. So if you ever hear about a patient receiving somatotropin or anything that has to do with somatotropin inhibitors, somatotropin is kind of another name for the growth hormone. So homeostatic imbalance, we talked about hypersecretion or hyposecretion causes many of the endocrine disorders. So gigantism is hypersecretion of growth hormone. And that's before age 25. At age 25, everyone, like all humans, are essentially done growing. So hypersecretion before age 25 leads to gigantism. This is mostly due to a tumor in the pituitary gland, and this is pretty serious. Comes with a lot of very serious and life-threatening conditions, including like high blood pressure. Sometimes enlargement of the heart leads to heart failure at a very young age. So it's a very dangerous thing to deal with when you have gigantism. The pituitary dwarfism is hyposecretion of growth hormone before age 25. Here you can see a boy with gigantism. This is a 12-year-old boy. Here you can see a girl with pituitary dwarfism, and then over here you can see a puppy with pituitary dwarfism. And looking at this puppy, you're probably like, oh, it's so cute and tiny. Why don't we induce pituitary dwarfism in all puppies to make them like super cute and tiny for the rest of their lives? Because just like with gigantism, pituitary dwarfism can be accompanied by some serious and life-threatening issues. The next hormone is prolactin. If we look at this hormone, prolactin, increases lactation, and it does this by doing two things. One, it causes mammary gland development, and two, milk production. Hypersecretion of this causes an increase in milk production in non-lactating women, so their breasts start to leak even though they're not lactating and didn't have a pregnancy. Hyposecretion doesn't really have a lot of bad things that can happen, but if a woman is trying to breastfeed, they wouldn't be able to produce enough milk in order to feed their child. So this is prolactin, and you can kind of break it apart to deduce what that really does. Prolactin, prolactation. The next one is thyroid stimulating hormone, abbreviated TSH. Thyroid stimulating hormone stimulates the thyroid gland to release thyroid hormone. When the thyroid gland releases thyroid hormone, it releases T4 and T3, which can be stored in the thyroid gland. Now, when it releases T4 is usually in excess, but T3 is really the active hormone. Either way, it's going to release these hormones, and the hormones actually tell the hypothalamus to stop stimulating the anterior pituitary to release thyroid stimulating hormone. In other words, if you have enough hormone floating around, you don't want to stimulate the release of more thyroid hormone. So it kind of acts as a negative feedback mechanism. You release it, and as soon as enough of it's released, it can go back and shut off that system. So thyroid stimulating hormone, again, the function is to stimulate the thyroid gland to release thyroid hormone. Adrenocorticotropic hormone. If you look at that big word, it can kind of seem a little bit difficult to memorize. There's a lot of letters in a row, and even pronouncing it might be difficult. But again, break it down into its stems. Adrenocorticotropic. We're talking about the adrenal cortex. And tropic is when one hormone stimulates the release of another hormone in another endocrine gland, or one endocrine gland kind of stimulates another endocrine gland. So we're talking about a hormone that's released from the anterior pituitary, and it stimulates the release of hormones, particularly cortisol, from the adrenal cortex. So adrenocorticotropic hormone stimulates the adrenal cortex to release cortisol. One of the homeostatic imbalances associated with ACTH, or adrenocorticotropic hormone, is Cushing's disease. Cushing's disease is a fairly common disease, and it's due to hypersecretion of adrenocorticotropic hormone, which leads to hypercortisol, or too much cortisol floating around in the bloodstream. Commonly caused by a pituitary tumor that's secreting excess ACTH. But these are some of the symptoms. So proximal muscle wasting and weakness, osteoporosis, glucose intolerance, hypertension, hypokalemia, if you remember that term, not enough potassium, and you know what that has to do with the heart rate, thromboembolism, depression, psychiatric disorders, infections, so an increased likelihood in infection, glaucoma can happen. So that's an increase of aqueous humor fluid in the anterior cavity of the eye. So you have blurry vision from that. Then you can see kind of what else can happen. So gynecomastia is breast development in men. Sodium and fluid retention in the body. You have edema, CNS irritability, and so forth. So there's personality changes. You see this petechiae, the bruises that kind of form the purple lesions on the skin. So all sorts of bad stuff can go on. So what you try to do is find the underlying cause of why you have excess cortisol and treat that cause. And it may involve resection of a tumor. Follicle stimulating hormone. We'll learn about this at the end of the semester when we go through the reproductive system. But basically, on the ovary, you have all of these eggs sitting there in these pre-follicles. And once a month, as soon as puberty happens, they are stimulated to start to migrate toward the surface. And they'll migrate toward the surface and start to continue on developing the egg and increase in the division of the egg or the meiosis of the egg to produce a viable egg that can be used for fertilization event and then pregnancy. But the eggs that are in here have to mature, and on their course, on their journey toward the surface, they're going to develop into a primary follicle and then a secondary follicle, and eventually ovulation is going to happen and they're going to be releasing eggs to go get fertilized in the fallopian tube. The maturation of the follicles, so allowing these eggs to grow up and develop so that they're ready to be fertilized, that is regulated by follicle stimulating hormone. So follicle stimulating hormone for a woman stimulates the maturation of the follicle on the ovary. Now what it does in a man is it stimulates the production of seminiferous tubules and sperm production. So follicle stimulating hormone in a man increases sperm production. Another word for sperm production is spermatogenesis. Genesis is the creation of something. Spermato is talking about sperm. So spermatogenesis, that's kind of the scientific term for sperm production. The luteinizing hormone. Now if we look at this ovary here, as this follicle develops and as the egg grows inside of here, eventually the egg is going to be released. And that egg gets released into the fallopian tube in hopes to go have a sperm cell unite with it so that the fertilization event can occur and you can have a successful pregnancy. What's left behind on the ovary is known as the corpus luteum. And the corpus luteum is going to start producing progesterone. And what progesterone is going to do, and we'll define progesterone again at the end of this lecture slide show, but progesterone tells the uterus, wait, do not menstruate. There's a possibility that we could be pregnant, so just hold off for a week and allow this egg a chance to get fertilized and to implant so that we can have a baby. So this corpus luteum and production of progesterone from it is regulated by the luteinizing hormone. So the luteinizing hormone promotes ovulation in a woman. There's actually an LH surge, they call it, where even big surge of the concentration of luteinizing hormone, and then that leads to ovulation. And regulation of the corpus luteum. In men, the luteinizing hormone is going to stimulate testosterone production. And I'm going to add and progesterone release from that corpus luteum just because that's what we just talked about. And then in men, stimulates testosterone production. So these interstitial cells in the testes are going to produce testosterone, and that's all regulated by the luteinizing hormone. Antidiuretic hormone. If you think about what a diuretic is, a diuretic makes you pee. If you've never heard of a diuretic before, I'm sure you've heard of diarrhea. What is diarrhea making you do? You lose a lot of water in the feces. So if we're saying antidiuretic, that means we're against water loss. The antidiuretic hormone promotes water retention. So it's going to stimulate the kidney tubules to reabsorb more water. Another major function of antidiuretic hormone is it wants to increase your blood pressure. So you've got your blood vessels, and inside of your bloodstream you have red blood cells, you have white blood cells, which have their little nuclei inside of them, and then you have a lot of liquid. Now if your blood pressure drops, what's really happening is the liquid volume in here is decreasing. So how do we increase the pressure of your blood? Well, if we flood more water in here, then we're going to increase your blood pressure. So blood pressure is the pressure of the volume of liquid pushing on the walls of the arteries. So if we put more liquid volume in here, we're going to increase your blood pressure. Well, if we retain water, we're keeping water in the body, we're decreasing urine output. That means that we're going to have more liquid in here, more volume, which means we're going to increase our blood pressure. But there's another way that we can increase blood pressure. If you've ever squeezed a water balloon before, you're decreasing the volume of that water balloon, which increases the pressure inside of it, and eventually it's going to burst because you've just squeezed it and the water balloon's going to explode. Well, another way to increase our blood pressure is by decreasing the size of the space between the walls of the blood vessel. That's known as constricting our blood vessels. Another name for antidiuretic hormone is vasopressin. And this kind of secondary function promotes the constriction of arteries. So together with water retention and constricting our arteries, we are going to increase our blood pressure. So that's what the antidiuretic hormone does. On a quiz, I'm not really going to talk too much about vasopressin, but if you're going into the nursing field, knowing that another word for ADH is vasopressin is going to help you, and knowing that it plays a major role in increasing blood pressure is another kind of thing that's going to be important later on in your careers. But for this class, what you need to know is ADH, antidiuretic hormone, increases water retention in the kidneys. So you're going to retain water in the bloodstream. It decreases your urine output. Diabetes insipidus. Diabetes insipidus doesn't have anything to do with the pancreas or insulin. What diabetes insipidus is it's hyposecretion of antidiuretic hormone. And with this one, if you're not producing enough antidiuretic hormone, remember antidiuretic hormone makes you keep water in the body. What's going to happen is you're going to start peeing a lot. That's known as polyuria. Increase in urine output. Another thing is it's going to make you really thirsty because your body is going to be losing a lot of water in the urinary system, and you're going to have to replace that water. So you're going to have excessive thirst, polydipsia, and excessive urination, polyuria. So now we're going to switch gears and talk about the posterior pituitary gland. Remember, the posterior pituitary gland does not produce its own hormones. These hormones are produced in the hypothalamus and released from the posterior pituitary. There's only two of these. So one of them is oxytocin. If a woman needs to go and have labor induced, they're going to give that woman Pitocin. And Pitocin is oxytocin. So basically it's the medicinal form of oxytocin. And what oxytocin does is two major things. It's going to stimulate the uterus to contract. So it stimulates uterine contractions during labor. And the second thing is it causes milk letdown. Milk letdown basically means that it causes the milk to be secreted from the mammary gland. And I'm sorry, let's just go back. Antidiuretic hormone is the other posterior pituitary hormone. So we shifted gears and then I kind of caught up with it too late. So posterior pituitary hormones, the first one is antidiuretic hormone and the second one is oxytocin. Pineal gland. So the pineal gland is located back here in the brain. Now your pituitary is up toward the front part of the brain. The pineal gland is located in the back part of the brain. When we get to our brain dissection later on in the semester, or when we do some of these virtual dissections, you will be able to locate the pineal gland. The pineal gland releases the hormone melatonin. Melatonin regulates the sleep-wake cycle. The lowest levels are supposed to be in the bloodstream around noon. So for a normal diurnal person that's, up during the day and sleeping at night and on a regular work schedule and everything, the lowest levels are supposed to be at noon. Production of melatonin is inhibited by sunlight. So if you're up and awake in the sunlight, then it decreases the production of this melatonin. Melatonin makes you sleepy. And even though this is a hormone, can be purchased as a vitamin supplement and it's sold over the counter at stores. So you can take melatonin to help you sleep at night. A homeostatic imbalance associated with melatonin is seasonal affective disorder, called SAD. It makes you sad in the wintertime. In the wintertime, when you don't expose yourself to a lot of UV light, then you increase your melatonin production and you kind of get sleepy a lot, and some people even get depressed in the winter time. So seasonal affective disorder has been linked to the pineal gland due to the increased production of melatonin that makes you tired in the winter time.